Question 1. What is medical coding? Answer. Medical coding professionals provide a key step in the medical billing process. Every time a patient receives professional health care in a physician's office, hospital, outpatient facility or ambulatory surgical center (ASC), the provider must document the services provided. The medical coder will abstract the information from the documentation, assign the appropriate codes, and create a claim to be paid, whether by a commercial payer, the patient, or CMS. Question 2. What are the 3 ways to organize bill paying? Answer. Paper, folder or binder, digital bill paying. Question 3. What are medical billing codes? Answer. Medical billers take the coded medical record and bill the insurance company. Medical billers work in doctors' offices, clinics, and hospitals. It is possible for a medical biller to work at home as well. If you enjoy working in front of a computer, data entry, and keeping up with the latest health insurance rules and regulations, then this would be a great career choice for you. Question 4. What are the types of medical billing coding systems specific to healthcare? Answer. Diagnostic codes, pharmaceutical codes, topographical codes are types of medical coding. Diagnostic codes are used to determine disease. Pharmaceutical codes are used for identifying medicines. Medical coders will convert the notes of physician into appropriate codes. Question 5. In medical terms, which is more serious, a code red or a code blue? Answer. There are no standard definitions or conventions for the use of code designations. While code blue does refer to a cardiopulmonary arrest at many hospitals, it doesn't necessarily mean the same thing everywhere. Question 6. What is ICD-10-M, ICD and ACS? Answer. The International Classification of Diseases (ICD) is published by the World Health Organization (WHO) for worldwide use in translating the narrative descriptions of diseases, injuries and procedures contained in medical records into alphanumeric codes. In Australia, the classification system is ICD-10-AM, ICD and ACS, International Classification of Diseases 10th Revision, Australian Modification, Australian Classification of Health Interventions and Australian Coding Standards. The National Case Mix and Classification Centre (NCCC) is the Australian body which prepares, updates and publishes new editions of the coding volumes in book and electronic format. Question 7. What is a clinical coder? Answer. Clinical coders convert information from a patient's medical record into alphanumerical codes according to a health classification system. The health classification system used in Australia is the International Classification of Diseases 10th Revision, Australian Modification (ICD-10-AM), the Australian Classification of Health Interventions (ACHI), and the Australian Coding Standards (ACS). These codes form part of a data collection that is used for research, funding and healthcare planning. The use of a classification system makes it easier to store, retrieve and analyze data. Question 8. What do you think about medical billing future? Answer. With the advent of healthcare reform, many people are looking into medical billing careers. The Occupational Outlook Handbook says this career field is expected to grow through 2018, which means it is a solid and stable career choice. The great thing about most medical careers is that they remain steady even during an economic downturn. Medical billers take the coded medical record and bill the insurance company. Medical billers work in doctors' offices, clinics, and hospitals. It is possible for a medical biller to work at home as well. If you enjoy working in front of a computer, data entry, and keeping up with the latest health insurance rules and regulations, then this would be a great career choice for you. Question 9. Name some good electronic billing software systems. Answer. Some of the best electronic billing systems include Sage and QuickBooks. These have been the industry leaders for a number of years. Both offer free trial versions to potential customers. Question 10. Define write-off in medical billing. Answer. Write-off is the difference between total charge and the allowable amount by the insurance.